Now I know.
Hi again, and welcome to my channel, Body Talk, a universal language of physical symptoms for health and healing, mind, body, and soul. My name is Lolita Moore, and I am your clinical nurse consultant. Again, I want to welcome you to my channel. I'm so happy to have you here. For those of you who are new, please feel free to subscribe and like and share. And for those of you who are already subscribed, just simply click the like button, leave a comment. If you have questions relating to this subject, feel free to post them. I try to read as many as I can, and then I may be able to address some of those questions in another video. Okay, so for this video topic, I'm going to discuss hemorrhaging, also known as excessive loss of blood. So what is excessive loss of blood, or what's the result of an excessive loss of blood? And the answer is hypovolemic shock. So when the body does not have enough of the life force, which is blood, in it, it can no longer function in a normal capacity or in a state of balance, or remember the word homeostasis, which means balance as well. The result of untreated blood loss can result in what we call hypovolemic shock, which is another word for low blood volume in the body. This is a very serious condition, and it should be interrupted. The bleeding should be stopped immediately, and further examination should be implemented or started to determine the root cause of the blood loss. If you or someone that you care for or a loved one should experience blood loss or bleeding, here are a few signs and symptoms that you will experience as a result of excessive blood loss. Weakness, fatigue, increased thirst, dehydration, increased urine, diarrhea, arrhythmias, also known as irregular heart rate. Your heart may beat too fast because the body is trying to catch up and compensate or make up for the blood that it's losing. You may experience a weak pulse. You may even experience a change in your level of consciousness, for example, confusion. You may become restless. You might even experience vomiting, pain, and or shortness of breath. Another sign that your blood volume is severely low is what we call cyanosis, which is another term used for turning blue. When this happens, this means that the affected person experiencing this bleeding event or medical emergency is going into shock and could possibly die. So what are you going to do should you find yourself in this situation? The first thing you want to do, because it is a medical emergency, you're going to call 911 if you're able to, or call for help if there's someone around you when you're experiencing this. You want to just yell for help. If you're able to speak with someone over the phone, like the paramedics, you want to stay on the phone. Or if it's not you and someone else that you're caring for, you want to stay with that person. Call 911, get instructions, follow the instructions until paramedics come. While you're waiting, in the meantime, here are some things that you can do. You will want to apply direct continuous pressure and elevate the area if possible. This will control the bleeding and assist in clot formation. If possible, you want to get a gauge or an idea of how much blood is lost. This you will need to report to the paramedics or to medical staff, so during their plan of care for you, it can be determined whether you need fluid replacement and how much. Please know that this is another medical emergency in which you do not want to try to have anyone take you to the hospital. Time is of the essence. Time for treatment. The faster treatment begins, the better chance of survival. So you will want to, again, wait for the paramedics to get there and begin to treat you while you're on your way to the hospital. I hope this is beneficial to you. Please hit the like button. Subscribe if you are not already a subscriber, and feel free to share. In the meantime, take great care. Bye for now. See you in the next video. Please understand that the information on this page is for educational purposes only. It is not in any way intended to diagnose anyone's medical condition. Please contact your doctor first before trying these recommended preventive care measures. If you have a medical emergency, I strongly recommend that you call 911 or go to the nearest emergency room for further evaluation. Thank you for stopping by. Feel free to like and subscribe to my channel if this content is helpful to you. I would love to have you in our community. And always remember, when the body talks, listen, because your life depends on it.